Thank you so much. Thank you to the meeting organizers. It is a pleasure to be back at SICSSO. This is truly a wonderful meeting, and I appreciate so much the invitation from my dear friend Enzo. Today I want to talk to you about, do we still need corneal donor tissue? And I have no financial interest or arrangements with anybody or anything we'll be talking about. We learned from our previous presentations by Dr. Katerina Sarnicola, Dr. Kinoshita, all about endothelial cells, all about Fuchs dystrophy. We know that endothelial keratoplasty has been going on for 15 years. The guttata appears centrally and then in the paracentral cornea later. There is a distinct subset of Fuchs patients where the guttata are confined to the central cornea. These are very distinct subset of patients, and these are the patients I want to talk to you about, because in these patients, the guttata cause intraocular light scatter, increased higher order aberrations, and decreased contrast sensitivity in vision. So, central Descemet's stripping has been done in this select group of patients with the central 4 millimeters of Descemet stripped. This was first described, I think, by Brownstein from my review of the literature. Numerous reports by Blayan, Koenig, Galvis, Borkar, Shaw, Maloney, and Arbelaez have all showed that the majority of patients clear. And Dr. Colby has identified different types of responses, the fast responders, slow responders, and non-responders. So with this, we also know from the paper in the June issue of Cornea by Maloney, as described previously, that Rho kinase inhibitors aid in corneal clearance as a rescue for the 2 of the 3 patients that did not clear in his study. And we know that these Rho kinase inhibitors are important in both smooth muscle contraction as well as endothelial healing. Glanatec is the trade name of the the only commercially available Rho kinase inhibitor from Kawa. It's a 0.4% solution. It's a selective ROCK1 and 2 inhibitor approved for the treatment of glaucoma in Japan. It has been demonstrated to have intraocular penetration, and in vivo work by Kinoshita, which was earlier discussed, demonstrated Rho kinase inhibition has a beneficial effect on corneal endothelial healing. So with this in mind, I worked with the following hypothesis, that primary descemetorrhexis in Fuchs corneal dystrophy will heal faster with a higher final endothelial cell count in patients with Fuchs dystrophy and guttata limited to the central 5 millimeters of the cornea when placed on topical Rho kinase inhibitors in the immediate postoperative period. So, these are the inclusion criteria for our study. Fuchs dystrophy patients with guttata limited to the central 5 millimeters of the cornea with a clear peripheral cornea with an endothelial cell count of 1,000 cells per cubic millimeter. The visual disturbance from the cornea was evidenced by morning blur or central corneal edema with a best corrected visual acuity worse than 20/50, thought to be attributed to the cornea. No visible subepithelial haze that we thought could interfere with the post-op vision. 10 patients with 10 eyes, 1 eye from each patient, have been enrolled to date with 3 months follow-up. Further evaluations and further enrollment are in progress. This is a preliminary report. 5 patients underwent primary descemetorrhexis with or without cataract extraction and observation with postoperative medications of polytrim, prednisolone, and sodium chloride ointment at bedtime. 7 underwent primary descemetorrhexis with or without cataract surgery and Glanatec drops beginning post-op day number 1, in addition to the above regimen. So these are the patients we're discussing, patients with central Fuchs where the peripheral cornea appears quite normal, and the Fuchs is really seen primarily here. These are not every Fuchs patient that walks into your office. This is how the patients look immediately post-operatively with central corneal edema, which is quite severe. And Here, it doesn't show so well, but post-stripping, I don't know, can you see the edge of where it's stripped over here? Here we have the patient, oh, here we go. Now it's reepithelializing. Here's the edge of the stripping, as you can see, at high magnification. So what happened to the patients and what were the outcomes? First of all, Repassidil, the Rho kinase inhibitor, does cause redness and stinging in almost every patient who took it. One patient had severe abdominal pain and constipation by day 3. This recurred after discontinuation of the Rho kinase inhibitor and reinstituting the drop. So for this patient, Rho kinase was not acceptable, so he was moved to the observation group. So what I'll report to you on is 5 patients that were observed and 5 patients that were treated with Repassidil. So in the 2 groups, as you can see, in the observation group, there were 4 females, 1 male, 5 females in Repassidil group. Pachymetry was looked at pre-op, again post-op. We measured the number of weeks to the vision being better than 20/40. We looked at their endothelial cell counts and complications. The average age in each group was about 71. The pre-op pachymetry was very close, over 700 in both groups as measured centrally. And the post-op pachymetry at 3 months was also very similar, perhaps slightly better in the Rho kinase group. The number of weeks until the vision was greater than 20/40 differed significantly. In the Rho kinase group, approximately 5 weeks post-op, the patients were seeing vision, having vision of better than 20/40 after a 5 mm stripping, and in the observation group, it took an average of 10 weeks. The endothelial cell counts in the patients treated with Rho kinase inhibitor were significantly higher, though the N is very small, than the patients who were simply observed with no Rho kinase inhibitor. So here we see no Repassidil, 3 weeks post-op, 6 weeks post-op. And here we see Repassidil at 3 weeks post-op, 6 weeks post-op. Endothelial cell counts of both groups at 12 weeks post-op with no Repassidil on your left and Repassidil on your right, with the higher cell count seen in the patients treated with the Rho kinase inhibitor after Decimase stripping. So in conclusion, in our very small series of 10 patients now, 3 months out, all patients cleared, but the patients on Repassidil supplementation cleared faster with a higher endothelial cell count. 1 patient was intolerant of the Repassidil drops, and our conclusion to date is that Repassidil appears to increase the rate of corneal clearance and endothelial cell count after selective Decimase stripping in patients with Fuchs dystrophy confined to the central 5 mm of the cornea. There's still very much to do. We have many different arms of this study that we're looking at. We're still enrolling patients. I should have said at the beginning, this has been done under an IND permission from the FDA in the United States and IRB approval. So I want to thank you very much for your attention, and I look forward to giving you more information about this in Salerno next year. Thank you for your attention.